How on earth did Nyoku manage to work inside a hospital under a completely false name for 2 entire months without anyone noticing?
Before we get started, I'd really appreciate it if you could subscribe to my channel. It helps me keep making more videos like this. Thanks so much. Now, let's dive in.
So on one side, you've got Lucius Njoku. He's 33, a fully qualified nurse from Nigeria. And apparently he was just really desperate to start working while he was stuck waiting for his background checks to clear. And his partner in this whole scheme? That was 32-year-old Joyce George. She's the one who actually got the job through an agency and then just handed her identity over for him to use.
How on earth did Nyoku manage to work inside a hospital under a completely false name for 2 entire months without anyone noticing?
The whole fraud took place at the Countess of Chester Hospital. This is a facility that was already under this intense public microscope because of the horrific Lucy Letby case. The fact that a man could then work for months using a woman's ID right under their noses, it just immediately raises some really serious questions about the hospital's security and staffing procedures.
And for a while, from February to April, the plan actually worked. For 2 whole months, Njoku would just walk into the hospital, pop on Joyce George's name badge, which unbelievably had her photo on it, and just do all the duties of a healthcare assistant. And we're not talking about paperwork here. This was hands-on, intimate patient care, like washing, dressing, and taking medical observations.
So after 2 months of this deception, you'd think it would be hospital management or security that would catch on, right? Nope, the entire scheme came apart because of one very observant patient.
It all started when a patient just looked at the ID badge. He saw the name Joyce and a woman's picture, but the person looking after him was very clearly a man. So he confronted Njoku, got that bizarre confession, and then, rightly, he reported it straight away. From there, it was like dominoes. Staff checked the CCTV, confirmed it wasn't Joyce George, and the police were called in. They raided her home and, sure enough, they found both of them there.
And when the police searched their phones, oh boy, it was an open and shut case. They found text messages where the two of them were actively coordinating hospital shifts. I mean, it was clear proof this was a pre-planned deception. But here's the kicker. Even with that evidence, when the police questioned them, both Njoku and George just answered no comment to every single question.
The legal outcomes could not be more different. Lucius Njoku, he pleaded guilty to fraud. He managed to avoid jail time, getting a suspended sentence, but he still had to do unpaid community work and pay a fine. Joyce George, on the other hand, she fled the UK before she could even face court. Now she's officially a fugitive with a warrant out for her arrest.
Now, there is an international arrest warrant out for her, and it's worth noting that the UK and Nigeria actually have an extradition treaty. So what does that mean? It means Joyce George could, one day, be brought back to the UK to face the justice system she ran away from.
So even though Lucius Njoku didn't end up in prison, his decision to commit this fraud had these immediate and really severe consequences. It basically left his entire career in ruins.
And the judge, when he was sentencing Njoku, really hit the nail on the head. He told him, "You deceived your way into a job which requires safeguarding checks. That undermines the system." You see, the court's biggest worry wasn't just the lie itself, it was the fact that he completely bypassed the safety rules designed to protect vulnerable patients.
His defense team tried to paint a picture of impatience, not malice. His lawyer kept stressing that Njoku was in fact a qualified nurse, that no patients were ever harmed, and that there were 0 complaints about his actual work. The argument was basically, look, this was an act of desperation by a guy who just wanted to work, not someone trying to cause any harm.
So, when all the dust settled, what was the real-world cost for Njoku? Well, his nursing career is completely over. Having a criminal record for fraud means working in healthcare is just not an option anymore. He's since gotten a job at a car factory, but his future here in the UK is super shaky. He's a dependent on his wife's visa now, and deportation is still a very real possibility.
And this whole crazy story really leaves us with a tough question, doesn't it? Was this just the act of 2 dishonest people? Or does it also shine a light on the pressures immigrants face, and maybe some serious gaps in a hospital's security systems? It really forces you to ask, where is the line between personal desperation and a systemic failure?
You won't want to miss what's next. Subscribe, like, and follow for more updates straight from Bao's News Network.